you're injured or you're having pain and you're wondering whether or not you should be using ice or heat, this video is for you. I get asked all the time by patients and even texted by patients if they hurt themselves on the weekend or we don't have an upcoming appointment. Doc, so-and-so injury happened. Should I use ice or should I use heat? Generally speaking, if you have a new injury, meaning something happened in the last few days, maybe you have swelling, maybe you have discoloration, maybe it's tender and sore to the touch. If you've already been kind of cleared by your doctor or you don't think it's something necessarily that needs to be evaluated, you should be using ice. What ice is going to do is it's going to help calm down the inflammation process, prevent excessive inflammation beyond the little bit of inflammation that we want, and allow us to get to a point where we can start moving the joint and getting it healing very quickly. If you have, let's say, a chronic issue, so doc, a couple times a week when I'm sitting at my desk, I start to get some achiness in my lower back. Well, that's a perfect opportunity to use heat, right? So if you have a chronic issue, heat is much better. If you're dealing with, maybe it's chronic wrist pain while you're sitting on your computer, chronic lower back pain, something like that, heat. Now, let's say you have a chronic issue that's aggravated by movement. So doc, every time I run, my Achilles gets sore. My Achilles feels tight. My Achilles is swollen. Then you're gonna ice it, right? So if we have a new injury or a new re-aggravation, we ice. If we have a chronic kind of dull ache, day-to-day, week-by-week type of thing, we're gonna use heat. I hope that helps, guys. Of course, if you are injured, if you're in pain and you're looking for relief, give us a call, Miami Spine and Performance in Hollywood, Florida.